I will be talking all about looking after your hips with AS. My name is Zoe Clark, I'm an osteopath and I have AS as well. I've joined NASS recently to help on the helpline and to help provide advice and support for members during the COVID-19 outbreak. So if you've joined our live before, you'll know that I'm able to answer questions as we go along, but I'll also pop back into the comments over the next few days. So if you have anything you'd like to ask, please feel free to comment as we go along. If you'd like to get in contact with me for some more specific advice or any kind of personalised exercises, feel free to email me at zoe@nass.co.uk. The video will remain on the page today, so if you'd like to come back and view it later on, you're more than welcome to. We'll also be producing a blog and a write-up of the exercises we go through on the website later on as well. So firstly, does anybody have any questions? Feel free to pop them in the comment box, particularly about your hips and any sort of problems that you get with them. I will be going through some exercises today, so if you're not already, if you'd like to join in, feel free to change into something more comfortable. You want sort of nice loose fitting clothing, particularly leggings, and ideally you want something like a chair to hold on to for support, but also either an exercise mat or a bed to lie on for the exercises where we're lying down. They are very gentle exercises, so some people may find that they're not strong enough, in which case feel free to get in contact with me. I can put together some stronger exercises for you personally. So firstly with the hips and AS, I'll go through a little bit of the anatomy and then why they're important and what we can do to help with that. So the anatomy of the hip joint itself, quite often people, when they describe the hip joint, they point more up to their back and their pelvis, and they're actually surprised that the hip joint is lower down than they think. So the joint is formed by the thigh bone, the femur, and it comes up and it sits into a socket in the pelvis. So this is a ball and socket joint, which means that the thigh bone has a lot of movement and the hip joint allows lots of movement and flexibility. This is really important because then when you're doing movements and activities and sitting, you've got that mobility, that range of movement there to allow that. There are lots of strong ligaments that attach all those bones together, and that keeps the joint nice and strong and stable. Then surrounding that, you've got all the muscles that attach into them. It's quite a complex area with lots of different muscles attaching in there, and that helps control the movement, but also keep the joint actually strong as well as stable. So whenever I'm talking about exercises, I'm usually focusing either on mobility or on strength, and then a lot of them will combine the two as well, which is really important for hips. You always want to be working both on the mobility, improving and maintaining that, but then also on the strength of the joint itself. So hi Nadia, hi Anne, thank you for joining. So in terms of actually preventing any problems with your hips with AS, primarily the biggest thing that you want to be doing is actually controlling AS itself. Similarly to the night pain video, I described that actually if you're getting pain and stiffness in your hips, you want to ensure that your inflammation levels are as controlled as possible, and that's something obviously you'd have to decide with your rheumatology team. What I'll be going through today is advice on things that you can do to help in terms of exercises and self-care that's going to help alongside that care. But certainly is not a replacement of actual individual advice from the rheumatologist. So why are hips important? Obviously, as I've described, we need them to move and we need them to be strong to allow us to do lots of different activities. But in AS in particular, it can be really helpful if you do have a stiff lower back, or if you have reduced movement or fusions in your back, the hips can actually really help in compensating for this movement. So for example, if you're trying to bend down to reach the floor and you've not got the nice flexible movement in the lower back and your back stays quite rigid, actually if your hips allow you to come into a closer angle like that, you're going to be able to reach further using your hips rather than using your back, which can be really helpful. You can also look at it in terms of when you're reaching for something overhead. If your back is stiff and you haven't got that ability to arch backwards with your spine, then actually having the movement in your hips and the stretching ability through the front of the hip, it means that when you're reaching up towards the ceiling, your hips can do a little bit of extra work in helping with that. So when you look at it from that side of things, it shows how important it is with AS. So as I said, a lot of the exercises can work on mobility, they can work on strength, or they can work on both. Lots of activities are really beneficial for hips in all areas. So particularly walking, running, jogging can be very helpful if that's comfortable for you. Swimming, hydrotherapy and aqua aerobics are great, particularly because you've got the weightlessness in the water as well. So if you do get pain in your back or in your hips, you're able to work the muscles and get the joints moving, but without getting the impact there as well. Obviously, at the moment, we're unable to do that, but hopefully soon we'll be able to get back out into the pools and into the gyms to help with that. Lots of exercises like Tai Chi, Pilates, yoga, Qigong, they're great ones which are going to combine both getting the flexibility there, but also the strength as well. It's something when people ask if yoga or Pilates are appropriate, I always say it's worth speaking to the teacher to check what style of yoga they do and ensure that although you are wanting to improve your flexibility, you want to make sure you're doing it safely and improving the strength of the muscles as well. So particularly if it's poses where you're not necessarily trying to advance the posture too much, you're trying to hold it and get the strength there and the support for the joints. That's much better than just trying to improve the flexibility alone. You can also use lots of different gym equipment, so rowing machines, steppers, exercise bikes, and cycling outdoors, of course, as well. These are great on working both on the flexibility, but also the strength of the joints too. In terms of just strengthening the hip on its own, you can do resistance exercises, so either with a resistance band, the elasticated bands, or you can use machines and gym equipment as well. So now we are going to go through a few exercises. I'm going to go in a few different sections, so standing, seated, and then lying down as well. As I said, have something nearby for support if you need to, so a chair to hold on to. If you'd like to join in the exercises where you're lying down, pop the exercise mat down or do it on your bed if that's easier and more comfortable as well. With all these exercises, they should be comfortable, so don't push through any pain. If it's uncomfortable, then stop and take a rest. We will be providing lots of written exercises afterwards and a blog post, so do keep an eye out for those, and I'll pop a link in the comments when they're live as well. So if you do want to revisit the video at any time or the exercises, you're able to do them in your own time as well. So yeah, don't overdo it, keep it comfortable, but hopefully join in and find it helpful. So I've got a little bit of a makeshift studio here at the moment. Really key as well, let's see how high I need this. Really key as well is to make sure that you've got lots of space around you. You don't want to be kicking anything, hurting yourself, or breaking a TV and getting told off. So with the standing exercises, first of all, just to loosen up the hips and loosen up the lower back a little bit, you can just pop your hands on your hips, pop your feet around about hip width apart, maybe a little bit wider, and then just swing your hips side to side to help loosen those up there. And this is quite a nice movement because you get a little bit of side movement in your lower back as well, and you get the hips moving a little bit too. Then when that's comfortable, you can do some circles, so you can bring it forwards and round one way. It's completely normal to get a few clicks and pops that you're feeling or even hearing coming from your back, your hips, your knees. As long as it's not painful when you get that clicking, it's just things loosening up, so don't be concerned. Great, so I'm just going to scroll down the comments and just make sure everyone is happy. Yeah, so Sarah's saying she's shielding and in a lot of pain because she's not going on her walk. So hopefully these exercises will help with that, because when you're walking, obviously you're getting a lot of movement through the hips that some exercises don't really do. So hopefully these will help cover that. This first one in particular will probably be really helpful for that. So if you get a chair or something to hold on to for support, if your balance is pretty good, you can just have your fingertips on the chair so that you've got it there to grab if you do feel a little bit wobbly, but you're not necessarily having to put any pressure through there. So firstly, we're working on the movement in the hip joint itself, which is around here. And we're going to be working on the movement of bringing the knee up towards you and then away from you. So these are the ones in particular I was saying about that when you've got the stiffness in your back, they're really helpful to take the pressure off, because if you're reaching down for something and you can't get the movement in your back, you're able to get the bend in the hips to actually reach that bit further. And similarly, when you're reaching overhead, if you can't arch backwards with your spine, then you've got the flexibility through the front of the hip so that you're able to bring that back and compensate for your back. So firstly, holding onto the chair for a little bit of support, you can relax your arm down by the other side, and you just want to gently lift one leg up off the floor and swing it forwards and backwards. And ideally just in a nice rhythmic, gentle movement. And just as far as is comfortable, if you're feeling any twinges or any pain, then don't push through that. You can do really tiny movements if your hips are particularly stiff. Certainly first thing in the morning, you may find that actually that's going to be about as much movement as you want to do, and then gradually as it loosens up, you can come a little bit further with that. As I said, make sure you've got space so you're not kicking anything in front of you or behind you. And then when that's comfortable, you can turn around so you're holding onto the chair again, and then again just loosen up through the other side. Apologies if you can hear my neighbour's hedge trimmer going. Perfect. And then when that's comfortable, we're next going to be working on the movement of bringing the hip across in front of you, bringing the leg in front of you, and then out to the side as well. So these are really helpful movements. If you do have any changes to the joint itself, quite often the movement where you're bringing the leg across can be a little bit uncomfortable. So don't push through that. Just go as far as is comfortable. Okie doke. So for this exercise, you want to come just to the front of the chair a little bit. So you're using it for balance if you need to. Just lift the leg in front of you slightly so your foot's just raised off the ground a little bit. And then just doing that movement so you're bringing the leg in front of you and out to the side, in front and out to the side. So again, just as far as is comfortable. Nice gentle movement. And this is going to be working on the mobility through the hip joint, but it's also going to be working on strengthening those muscles all around the joint as well. And again, you want to turn around and do the same on the other side. So going across your body, out to the side. And just nice, gentle, rhythmic movements. But stop if you're getting any twinges through the hip joint itself there. Great, so a little bit of a stronger exercise now. So in terms of bringing the knee up towards you, you can either use your hand to guide the movement, or you can use something like either a rolled up towel or a yoga strap, or even just a dressing gown band to help with the movement if you need to. So you can just wrap it behind your thigh there, almost at the back of the knee. And then you just gently use your arms to lift your leg up towards you. That's if you don't have too much movement, you're not able to get your hand down to your knee. If you are able to, you can just use your hands. So you can just bring one hand down and then come up and hold the back of the knee. If your balance is good, you may want to bring both knees to the front and hug the knee right in and then come back down. So it's just going to work on stretching through the back of the hip, but also working on that last bit of movement, bringing the knee towards you. So we'll do the same on the other side. So again, just bringing the knee up towards you. You can hold on for support if you need to, or you can use both hands. Test my balance live on Facebook and then come back down. How's everyone finding that so far? Let me know if I am going a little bit too fast. Yeah, and it's really common. So both if you do have any problems in your hips, you'll often find that it's not going to be even on each side, but it's very natural to have different balance on each leg as well. So you'll generally notice that one side is a little bit easier to balance than another. So Sarah asks, how often do you recommend doing these exercises? So generally, it depends on how strong they feel to you. If they feel really easy to do, you can do them sort of 2 or 3 times a day. If they do feel a little bit stronger, then I'd recommend just doing it either first thing in the morning or last thing at night. You may well want to do it once you've been up and about and walking and moving and loosened up first, but you can do it up to about 3 times a day, depending on how it feels for you. Heather says she can barely lift at all. That's absolutely fine. I'm going to go through a few seated exercises as well, which should be a little bit easier, and the lying down ones as well. Oh, brilliant. Jane found the strap. A good idea. So again, repetitions, it does depend again on how it feels for you. So I normally would say around about 5 repetitions for the leg swingings. And then from when you're holding the knee in, I'd hold it for about 3 to 5 seconds and just do a couple of times on each side. I will have all the repetitions written up in the blog and in the exercise sheet that I'll share afterwards. So don't worry about remembering all of those precisely, but definitely see how it feels for you and just adapt depending on how it's feeling. So the last exercise for standing, second to last exercise for standing, we are then going to do a stretch for the front of the hip. This does also stretch the back of the calf as well. So if you have any Achilles problems, take it nice and easy. Obviously, Achilles is a really common area for inflammation with AS. So if you've got any tendinitis going on right now, then just take it nice and easy. You can have the heel off the floor if you need to for this one. So hopefully you can all see. I might just bring it down a little bit for this one. So again, using a chair for support if you need to. So the leg that you want to stretch, you're going to take a big step behind you. Depending on how it feels, you might want to go smaller to begin with. And then if it feels fine like that, you can just step back a little bit further and just modify it as needed. Okay, I'll bring it down a little bit more. So you take it a step back as far as comfortable. Make sure that your toes are both facing forward. It's really easy. The body often wants to cheat and sticks one foot facing out. So you want to make sure those toes are facing forward if comfortable. With your front leg, you bend the knees slightly, and then you should feel a nice stretch through the front of your hip here, and you'll probably feel a bit of a calf stretch down in that back leg as well. If you're not feeling stretch, make sure that both your hips are facing forward. Again, another way that the body likes to cheat is it twists, and then you end up not really getting much stretch going on. It likes to get into the most comfortable position normally, which may be avoiding the stretch. So make sure that you've got both your hips facing forward, and you'll probably suddenly feel that stretch through there. Also, you want to make sure that your back is nice and upright. I'm aware you can't really see my back at the moment, but generally the back wants to lean forward so that you don't get much of a stretch here. So just bring your shoulders up, keep your head facing forward, and then that should get more of a stretch through here. And then you want to come back. You can hold that one for around 5 seconds, up to 30 seconds if you need a really strong stretch. But again, you can repeat on the other side. So you're taking one leg behind you, glance down and make sure your toes are facing forward. And then with the front knee, bend the knee. See, in this side, I can feel my left calf a lot more than I could on my right. It's really common that you'll get differences on both sides, which is quite interesting to notice. Once you're in that position, again, make sure hips are facing forward and your back is nice and upright. Then hold for 5, 10, 30 seconds if you need to. And then come back up. And you may want to just give your legs a little shake because that's quite a strong stretch at times. And the final standing exercise, or really it's a bit of a sitting exercise as well. So we're just going to do gentle squats, but we're going to use a chair behind us. So you've got that as a backup. So you want to stand feet around about hip width apart. Make sure you keep your head facing forward if you can. You can have your arms nice and relaxed beside you, or you can have your hands on your waist. And you just want to keep your knees over your ankles as much as you can, so they don't come forward over your toes too much. You just want to sit down as much as you can, take a seat, and then come back up. If you need to use arms on your chair to help with that, that's absolutely fine. But ideally, you progress to the point where you're not needing them. Now again, the way that the body normally cheats with this exercise is it would use your body weight to really throw forward to get the momentum to come up, rather than the strength from the legs. So you really want to ensure you do bring the body forward a little bit to get up as you're transferring the weight to then come up, but you don't want to be really launching forward because you're either going to overbalance or you're just going to end up straining things. So generally, feet planted nice and flat on the floor, and then just transfer the weight to the front a little bit, and then up and upwards. So almost imagine you're trying to bring your head straight up towards the ceiling rather than forwards diagonally and potentially falling over there. So I'll come back in and just check any questions I need to answer so far. Yeah, James finds hips are the particular area that is difficult, so hopefully these exercises will help with that. Nadia can't lie flat. That's absolutely fine, but I would say on the next exercises, I would probably leave them out because we're going to be lying down and I wouldn't want to aggravate anything. If you do want to get in touch with me to find any exercises that you could do that don't require lying down flat, feel free to send me an email. So, final exercises. Oh no, sorry, seated exercise as well, bringing the knee in. So I said I'd show you that more gentle version. If you do find it difficult when standing to bring your knee up towards you, then you can do the seated as well. So again, you can use the strap if you need to. So you just thread it underneath your knee, wrap around your hands a little bit, and then you can just use that to lift the leg up towards you. It's a little bit of a biceps curl at the same time as well. Or if you find it's comfortable, I'll show you from the side as well, you can just thread your hands underneath your knee. You can keep the hip nice and relaxed and hug it in towards your chest. Or if you want to make it more of a strengthening exercise, you can actually just use the knee, use the thigh muscles to bring the leg in towards you and come back down. With that one, I do around 5 repetitions as far as feels comfortable. Is everybody happy with those so far? And feel free to pop a thumbs up in the comment box, pop any questions in there as well. As I said right at the beginning, if you've joined recently, the video will remain on the page afterwards, and I'll have a write-up in terms of the exercises and a blog with all the advice that we'll put on the website a little bit later today as well. So finally, lying down exercises. So you can either do these lying on a mat, you put an exercise mat down, or you can do them lying in bed if that's more comfortable and if it's difficult getting up and down off the floor as well. So with these, I'll pop the chair out of the way. So to get down on the floor, you can, I recommend kneeling down one knee and then the other. So I'll bring the laptop down a little bit so you can see what I'm doing. So yeah, coming down on one knee and then the other if it is difficult with your back. The first one, we're going to be focusing on the rotation in the hips, because this is something that's quite difficult to do with standing. So if comfortable, you can lie flat down onto your back. Then what you want to do is have your knees bent up so your feet are flat on the mat, and have your knees and feet together, and you can pop your hands down beside you for a little bit of balance and support if you need to. And then you just gently roll your knees over to one side and then to the other. And again, it's really common that you'll feel lots of pops and clicks in your back and your hips as you do this. That's completely normal. As long as it's comfortable and it's not painful, it's absolutely fine. So you may find that you can only do a small movement, and that's absolutely fine. The main thing is just to get a little bit of movement through the hips. You will get some movement through the back as well, so just take it nice and gently. You can try and focus, keep your hips, your pelvis down on the ground, so getting much smaller movement, in which case you'd only be getting movement through the hip joint itself, or you can use it as a hip and back movement combined and just take the legs all the way over so that your pelvis lifts up, if that's comfortable. But it depends on whether you're wanting just to focus on the hips or on the back as well. So with this, you would want to do that around about 5 to 10 times, depending on how long it's comfortable. I hope you can hear me from down here as well, so do let me know if you can't. So the next one is, again, it's going to be that knee hugging movement and making sure that it's comfortable. So if it's difficult standing or seated, you can do it lying down as well. Again, you can use a strap to help with that. So with this one, I would put the strap on before I was laying down, just so that I know roughly whereabouts it is. So you can then come and lie down, and then you can use the strap just to bring your hip in towards you and just relax the leg there as far as comfortable, and then come back up. Or you can do without the strap. So again, just bringing it up, either putting the interlinked fingers on top of the knee and holding it there, or you can pop them underneath the knee and hold there if that's better. If you have any knee problems, I'd recommend holding under the thigh, because you don't want to be compressing the joint too much. And then come back up. This is a nice one just to do one at a time. If you want to make it stronger and a stretch for your back at the same time, you can do both at the same time, but it is going to be a bit stronger. So how has everybody got on with that? Any questions at all? Yeah, so we have a couple of people saying they can't lie with pressure on the sacroiliac joints. With those, I would recommend doing them in bed then, so you've not got as much pressure through there, or in the exercises, standing or seated, so you've not got the pressure. The last thing we want to do is get the hips moving, but then end up irritating the pelvis and the sacroiliac joints, so just find what works for you. If you've tried these out and you find that actually they're just irritating things, please do email me and I can have a chat with you either by email or on the phone, and we can put together some more personalised exercises. Because the thing with AS as well is that no two people are the same. No two people with AS are the same, but also we all have normal sort of injuries and aches and pains. And as we get older as well, we may well have osteoarthritis going on. So there's lots of different things that can affect how the exercises feel for you. So if you need anything personalised, please just get in touch. Yeah, Mark, so can't lie on his back at all. I'd stick with the exercises we did before then, so the standing and the seated ones, but again, just get in touch if you need to as well. Julie said she likes the clam exercise as well. That's really helpful. So you can do that lying on your side and bringing your knees out, and that helps strengthen all along the side of the hip joint as well. That's a really beneficial one. So that will be working the similar kind of movement as when we were standing and bringing the leg out to the side. It's going to be working all those muscles on the outside of the hip there itself. So how did everyone find those exercises? As I said, they were relatively gentle because I wanted to give more of a taster and get people started with those exercises, but then we can make stronger ones later on if needed. Nadia, my email address is zoe@nass.co.uk. I'll pop it on your comment afterwards as well. So actually, Liz has just come up with a question just at the perfect time because I'm about to talk about hip replacements. So Liz is waiting on another hip replacement. Flexibility of hips and lower back is rubbish. Okay, so with a new hip replacement, you don't want to bring the hip too far up. It depends exactly on how they've done the replacement. So it would be worth on the surgeon and the physios after the next replacement and just get an idea of how much movement you want to do with that. But I would just go as far as you would normally, like going upstairs, that kind of movement, so you're not going too far. You don't want to be doing anything that's really compressing the joint or anything that's rotating the joint too much as well, so just take it nice and easy. Again, feel free to get in touch if you need to. Oh, brilliant, James found that was a good workout, so that's good. Right, yes, so hip replacements. This is something we're a lot about. Around a third of people with AS do get involvement in their hip joints with the disease, with AS itself, but not everyone does go on to needing a replacement. Some people do get changes in the joint that is well managed with medication and with sizes and advice, but some people do find that they have replacements later on. If there's a case, then it's really, really important to have the strength in the muscles before the hip replacement and then after as well. So generally, hopefully you'd be seeing a physiotherapist through the surgeon before your operation. You get a tailored exercise plan so you keep the muscles as strong as possible, because that really does help speed up the recovery and help you back on your feet as quickly as possible as well. And running is another really common question I get. A lot of people with AS do want running safe for them. People wonder if running is safe in general in terms of osteoarthritis. Generally, running is perfectly safe. There are ways that you can help to make it more comfortable and to reduce the risk of getting any kind of irritation or flare-ups from it. Firstly, I'd recommend having really good trainers with a really good sole that's very good at shock absorbency, because the hips in particular, as you're walking, as you're running and you're getting the impact from the ground, the shock is going to go up through your legs from the hips and then up into your spine. So the more shock absorbency you have in the shoes itself, the less you're going to have to transfer up through the legs, through the hips into the spine itself. Generally, running is actually really protective and good for joints in general. So the old myth of sort of running and wearing your knees out, research recently has found that actually up until a certain amount, it is actually protective for the joints, so it's good. But with AS, because it's an inflammatory condition, everyone responds differently. So some people do find that with that repetitive impact, it does end up flaring things up. So really, the way to do it is just start nice and gradually. So both in terms of the distance and the speed. I recommend trying the Couch 5K app if you did want to get into running. So this helps guide you through getting from literally from the couch to running a 5K comfortably. But it helps because it's you listen to it as you go along, and it's people guiding you through doing a little bit of walking, a little bit of jogging, and mixing that, and then gradually increasing the distance that you're going as well as increasing the amount that you're running. So it's really helpful not to overdo it, and it helps build up your general fitness as well as the strength in the joints, and hopefully reducing any likelihood of a flare-up. A great way to actually tell if a new exercise is irritating your AS or not is to actually track your symptoms generally, and then whenever you do a new exercise or any exercise at all, you just jot that down with it, and you can monitor whether symptoms get worse over time since putting the new exercise in. So you can either do this with apps. So we really recommend the AS Symptom Tracker and My SpA. They're both available in the Apple Store and in the Google Play Store. I'll pop their names in a comment on here as well. Don't worry about jotting those down now. Because there are lots of different ways that you can track your symptoms on there. And you can also track your BASDI score, which is the score that rheumatologists use to help track how active your AS. So over time, you can track your general symptoms, you can jot down when you're starting new exercise, and then you can see over time if perhaps it could be irritating things and making things worse, or it could be actually helping things and reducing the symptoms that you're getting in general. So a good way to sort of check if it is helping or not. If running does aggravate things, you still want to have an exercise that really gets your heart rate up and gets the cardiovascular system working, then cycling is really, really helpful. And also cross trainer or step machines, they can also be helpful, or even just going up and down the stairs as well. You can take it nice and gently, but still, because you're getting the blood flow going, you're getting it up, be really helpful. So let's check the comments again, just make sure I've not missed anything. Okay, someone said they've not been offered physiotherapy before the hip hop. It depends entirely on the surgeon and on location as well. Sometimes they just give exercise, a sheet of exercise that you can do. Sometimes you do see a physio beforehand. It's well worth asking if you can, or even just seeing a physio if you need to, particularly if they specialise in hips or in replacements as well. It's well worth getting some tailored advice. As I said though, feel free to drop me an email anytime. Great. David's asking about left shoulder exercises. Feel free to drop me an email, zoe@nass.co.uk, and I can put it together for you. James, the couch to 5K, fantastic. Yes, if you're finding it a little bit painful the following day, I'd recommend monitoring that. If it's around about a day or so, 24 hours, then that most likely is normal sort of reaction to doing an exercise, like where you get the soreness in your muscles when you've started a new exercise. If you find that it's lasting more than 24 hours, or if it's really severe, then obviously take it down a step. But generally, it probably means that you're just working things and getting things moving, which is great. Anne, however, tried it but had a flare after the first week. That's the trouble with it. It's so individual, so it's worth trying all these different things and seeing if they help for you. Oh great, Mark's had insole, really helpful. That's fantastic. So yes, Bharat, a stationary bike can be really helpful. So you can either get the actual exercise bike itself, or you can get a system to put your bike on top of if you have a road bike, so you can have both. But that can be great, particularly if you do have one where you can change the resistance. Then you're able to start with a really low resistance or cycling without anything really affecting the joints or muscles. And then gradually over time, as your fitness and strength improves, you can turn that resistance up, make it a little bit more difficult, and you're going to build the strength in the muscles and joints as well. Let's see. Okay, so James is asking about footwear as well. So absolutely, in terms of running, it can be helpful. You can see a podiatrist, or you can see a specialist in a running shop to see exactly what shoes you need. But really, as long as you get a good brand with a really good supportive sole, then that generally is the best thing that you can do. You want them to be well-fitting as well, so particularly lace up, so that then your foot isn't moving around too much in the shoe. And then, yeah, in terms of general shoes when you're walking around, again, well-fitting and lace up preferably. Slip-on shoes can be comfortable, but in terms of longer distances, if your foot is slipping out a bit, you're going to end up using the muscles in the feet and in the legs a bit to help compensate for that, which can end up being a little more uncomfortable. If you're doing longer walking, particularly on rough ground, then walking boots are really helpful, because you've got the support around the ankle and you're going to help on that unstable ground, because the ankles themselves, like hips, they're very good with the range of movement, but they can be tough on them in terms of the muscles around there having to work hard to keep them stable as well. So walking boots are really, really helpful. In terms of self-care as well, so in particular, respond really well to heat or to ice. I would say the majority of people with AS do tend to prefer heat, but it's worth trying both and seeing which one you prefer. So I would apply heat or the ice directly to where you get pain. So generally it will be around the outside of the hip joint itself, but it can well mimic the SI joint pain. So you can get longer wheat bags and packs that will go right from the hip and then up onto the pelvis as well, which can be helpful. With heat, I would always wrap it in a towel, so using either a heat pad or using a hot water bottle, and again wrapped in a towel. Apply that for about 10 minutes, and in a severe flare-up, you can do it every hour if you need to. sometimes just first thing in the morning and last thing at night can be as much as you need. With ice, I would use an ice pack or bag of frozen peas, again wrapped in a tea towel, but I'd only place on for about 5 at a time. And obviously don't place the ice directly on the skin because it can lead to ice burns as well. So just 5 minutes on with the ice. Again, you can do it every hour if you need to, or just first thing in the morning, last thing at night. With both of those, obviously, it's important not, if you're using them in bed, not to fall asleep with them on. So if you are doing them just before you go to sleep, set a timer so you don't fall asleep with them on. Absolutely, as Nadia said, a heat blanket can be really helpful. And on the night pain video, someone also said about using a heated jacket as well, which can be really helpful. And my final advice is actually being able to use self-massage. This is something that for my patients who I'm not able to see face-to-face at the moment, I'm giving lots of advice on. So if you have a tennis ball at home, or if you ideally have something like this, a spiky massage ball. So these are sort of plastic balls, which they're quite firm, but they've got little spikes on them, so you can see. And so they can be really helpful to help massage the muscles. So with the hip itself, you'd want to be massaging the muscles around the thigh, so around the front, the side and the back, but also up into the buttock muscles and even into the lower back as well. If you're using a tennis ball or a spiky massage ball, or even a colleague has been recommending, if you don't have one of these, even using an apple, which obviously you don't really want to bruise an apple over it, but yeah, if you're really stuck, you can use that. You just want to place it on the muscle itself, and then place your hand down, and just do nice circular movements, like so. You want to be putting in pressure down that you're feeling the movement there, obviously stopping it from rolling away as well. You want to feel the pressure, and you want to really feel that you're getting into the muscle, but without causing any pain. If things are tender, then either apply less pressure there or stop altogether. It's really common to get tenderness on the outside of the hip joint itself, because there's an area there that can get inflamed, particularly the bursa helps protect the joint. If you've had bursitis before, you know how tender it can be. If that is the case, then avoid doing it directly over that tender area and just focus on the muscles all around there instead. If you do want to use the massage ball onto your back and onto the back pelvis, you can do it against a wall. So either standing there, placing the ball behind you, and then leaning onto the wall, and then moving your body to the side. You can also put the ball in sock and then use that to hold over the area, and then again moving side to side. Having it in a sock stops the ball from dropping and rolling away and spending more time chasing that than actually doing the massage. So I'll pop a link in the comments. These are really cheaply on Amazon, so I'll pop the link in the comments just to the general type. There's no specific brand I recommend because there's loads of them out there, but they're really reasonable. If you would be using quite often, it might be worth getting. Foam rollers can be helpful as well, but I would say that they can definitely be a lot more intense. So I would only progress onto using a foam roller if you've used the massage balls or a tennis ball quite frequently for a while, because you may find that then progressing on to using a roller, which usually means that you're putting your body weight onto it, it can be quite uncomfortable to begin with. So progress onto that if you need something a little bit stronger. So I hope that's covered everything for everyone in terms of hips and AS. I will pop into the comments and just see if there's anything that I picked up on. But generally, I hope it shows that there's lots that you can do to help manage the pain with AS affecting the hips, and also improve the mobility through the hips and improve the strength, hopefully help things long term as well. So I will see any questions. So asks, what's bursitis? So bursitis is inflammation of a little fluid-filled sac called a bursa. So anywhere in the body where your bones are near the surface, so like elbows, knees, hips, anything that needs a little bit more cushioning, or even muscles, you do get them, you get little fluid-filled sacs which provide a little bit of cushioning. So a common area where you can get inflammation of that is on the outside of the hip. It can be really tender to touch. Sometimes it can be actually warm to feel as well. There's lots of different treatments for it depending on the cause. So if someone was experiencing that, I'd want to really get to the bottom of what's causing inflammation in the first place. So if you've had it in the elbow, then sometimes you'll notice that it can really swell up loads. Lots of students get it if they're at a desk and leaning like this, because you've got that prolonged pressure there as well, which bursa aren't meant for. They're meant for short periods of shock absorbency and protect the joint without that long period of pressure. Yeah, Sadie's had that, and it's horrible sleeping, horrible trying to lie on that side. It can be really uncomfortable. Yep, and Anne says massaging your feet as well, spiky massage balls. I'm planning on doing a video of general massage with them at some point. It can be really nice on the sole of the feet, so placing the ball under the foot and then running your foot forwards and backwards over it can be really nice. A little bit ticklish at times if you're that inclined. Faye, thank you. I'm glad it's been helpful to have the support from all of us. But yeah, I can always get in touch if you need any more help. Right, I think that's everything in terms of questions. Feel free to put more questions in there, and hopefully I missed anyone. I will go through afterwards, so if I've missed anyone, I'll write back to you if needed. Thank you for joining everyone, and thank you for lots of questions. As I said, the video will remain on the page afterwards, so feel free to come back, watch it again, and I'll also put a link later on into the blog post and to the written exercises that we've put together. They will be put on the fantastic new page, My AS, My Life. So thank you to everyone who did the survey and who voted on their favourite name. Sally has now put the page together and it's looking brilliant. So hope you take a look at that new page, My AS, My Life. It's got lots of information all about how to self-manage your AS. If there's any particular areas you need advice on, please do get in touch and move things together. Next up on our live on Thursday at 4 p.m, we have Sophie Matthew, who'll be doing part 2 of her mindfulness in depth. So please join. If you've not seen the first video yet, pop back onto our videos and you can watch back and look back on all the previous ones too. So yeah, hopefully that was helpful. I'm on the helpline as well, so feel free to take a call. And if you can email me directly, it's zoe@nass.co.uk. So everyone, I hope you're all keeping well and keeping safe, and I'll see you next time.